and today we are going to discuss very interesting topic, that is hypoxia. So hypoxia is made up of two words, that is hypo and oxia. So hypo means decrease and oxia means oxygen. So hypoxia is defined as the decreased oxygen at tissue level. The competency is 6.6, and in this competency we are basically confined to describe and discuss physiology of hypoxia. The specific learning objective of this class is define hypoxia and explain the types of hypoxia, explain the cause of hypoxia, and describe clinical features and treatment of different types of hypoxia. Coming to introduction, so definition of hypoxia. So if you have to define hypoxia, it is defined as the deficiency of oxygen at tissue level. Anoxia means there is complete absence of oxygen at tissue. So this diagram shows the mechanism of how oxygen from atmosphere reach to the cell. So basically it happens because of the difference in partial pressure across the different structures. Like partial pressure of oxygen in atmosphere is very high, that is 160 mmHg, and in alveoli it is 104 mmHg. So difference between atmospheric partial pressure of oxygen and alveoli, the oxygen reach from the atmosphere to the alveoli. From the alveoli, oxygen goes to the pulmonary capillary, that is the venous end of the arterial end of the pulmonary capillary, and the partial pressure of arterial end of the pulmonary capillary for oxygen is 95. So this is the difference between the partial pressure of oxygen in alveoli and arterial end. The oxygen reaches from alveoli to the pulmonary capillary. So from pulmonary capillary, oxygen is transported to the left chamber of the heart, and from there it goes to the circulation through systemic circulation. So this is the diagram showing the different types of hypoxia. So hypoxia can be classified into four different types. Number one is hypoxic hypoxia. So the word itself says hypoxic hypoxia. So it is a type of hypoxia where there is lack of oxygen in atmosphere or the lack of oxygen in inspired air. So suppose we are sitting, hundreds of students are sitting in classroom, and classroom is very closed. So when you breathe in this environment, it is obvious that oxygen will decrease as we expire carbon dioxide continuously, and fresh oxygen is not coming from the atmosphere, so it causes hypoxic hypoxia. Another example is if we climb the mountain. As we climb the mountain, the partial pressure of oxygen decrease accordingly, and the person will have the lack of oxygen in inspired air, and that is called hypoxic hypoxia. Now coming to anemic hypoxia. In this type of hypoxia, the partial pressure of oxygen is normal, but due to the decrease in hemoglobin concentration, the vehicle for transportation of oxygen to the tissue, it causes hypoxia. Now coming to the third type of hypoxia is called stagnant hypoxia. So stagnation means there will be the stoppage or obstruction to the blood flow. So here the partial pressure of oxygen is normal, the hemoglobin concentration of blood is normal, but due to the obstruction in blood flow, the tissue lacks blood flow, and that leads to decreased partial pressure of oxygen at tissue level. That is called stagnation hypoxia or circulatory hypoxia. And the fourth hypoxia is histotoxic hypoxia, and here everything is normal. Oxygen, partial pressure of oxygen is normal, the hemoglobin concentration is normal, blood flow is normal, but tissue fails to utilize oxygen because of the toxic damage caused to the tissue. So we can see different types of hypoxia and its cause. So hypoxic hypoxia is caused due to decreased partial pressure of oxygen Anemic hypoxia is because of the decreased oxygen carrying capacity of blood. Stagnant hypoxia is because of the decreased blood flow or obstruction to the blood flow, and histotoxic hypoxia is because of the damage to the tissue. So here tissue fails to utilize oxygen. So cause of hypoxic hypoxia is low partial pressure of oxygen and inspired air, hypoventilation, and diffusion deficit. Diffusion deficit means there is lack of oxygen diffusion from alveoli to the blood because of the fibrosis of the alveoli. And last one is the venous arterial shunt. So here, when there will be admixture of arterial blood and venous blood, basically the partial pressure of oxygen will decrease or concentration of oxygen will decrease here. So it causes the hypoxia. Now coming to anemic hypoxia, the cause of anemic hypoxia is carbon monoxide poisoning, altered hemoglobin. Okay, so here anemia is a condition where there is decreased hemoglobin concentration. So if there is a decreased hemoglobin concentration in blood, it doesn't able to transport adequate amount of oxygen to the tissue. The other example is carbon monoxide poisoning. So in carbon monoxide poisoning, what happened? The affinity of hemoglobin binding to carbon monoxide is 210 times higher than the oxygen. So if there will be carbon monoxide poisoning, instead of binding oxygen to hemoglobin, carbon monoxide will bind, and that leads to decreased oxygen transport in the blood. Altered hemoglobin, it can be methemoglobin and other abnormal hemoglobin like cyan methemoglobin. Features of anemic hypoxia is decreased oxygen carrying capacity. Percentage saturation of hemoglobin to oxygen is decreased, so that lacks oxygen supply to the tissue. Now coming to stagnant hypoxia. Stagnant hypoxia happens because of the ischemia to the tissue, and it is because of the circulatory failure. When heart is not able to pump blood adequately, or if there is blockage in the arterial systems, okay, that cause circulatory failure. Then congestive heart failure and vascular obstructions. Features are arterial PO2 is normal, arterial oxygen content is normal, percentage saturation of oxygen to hemoglobin is normal, but here transportation of oxygen doesn't happen, and that leads to hypoxia. Now coming to histotoxic hypoxia. So here in histotoxic hypoxia, basically oxygen is required for oxidation of foodstuffs, okay, in the body or in the cell. And in the histotoxic hypoxia, because of the toxins or cyanide poisoning, the cytochrome oxidase system in the cell get destroyed, and that leads to decreased production of ATP, okay, and that ATP is utilized for the movement of body part, metabolism, and all other body activities. So if there will be cyanide poisoning, so there will be destruction in cytochrome oxidase system, and that leads to hypoxia because tissue is not in a condition to utilize oxygen. So here the partial pressure of oxygen is normal, oxygen content is normal, percentage saturation of oxygen to hemoglobin is normal, arteriovenous perfusion is normal, but oxygen tissue is not able to utilize oxygen. Now coming to symptoms of hypoxia. So hypoxia symptoms can be divided into two parts. One is early symptoms and another is late symptoms. The early symptoms of hypoxia is restlessness, anxiety, tachycardia, and tachypnea. And if the condition is not treated and it gets worsened, it leads to bradycardia, extreme restlessness, and dyspnea, that is severe difficulty in breathing. Now coming to effects of hypoxia on different systems. So effects of hypoxia on respiratory system is the respiratory system lacks oxygen, and that leads to decreased perfusion of oxygen to the tissue because it lacks oxygen. On CVS, the similar effects are acute alcoholism. In CVS, if there will be hypoxia, This effect will look like alcoholism, impairment, judgment, depression, motor incoordination, fatigue, drowsiness, nausea, headache, talkativeness, and emotional outbursts. It is seen in case of alcoholism also. Now, coming to the effect of hypoxia on CVS, that stimulates vasomotor centers and that increase BP and that decrease cardiovagal tone because of the inhibition of vagal system. Okay, and that leads to increased heart rate. Since vagal system is responsible for inhibition of the pressure area, and since the vagal tone is decreased, the heart rate will increase. Coming to chronic hypoxia. Chronic hypoxia leads to polycythemia. This is the compensatory mechanism. If there will be decreased oxygen level in tissue for long period of time, body develops a phenomenon like polycythemia. How polycythemia occurs? Because lack of oxygen causes stimulation of renal system, and that leads to production of erythropoietin, and that erythropoietin acts on the erythropoietin acts on bone marrow to produce more RBC, to produce more hemoglobin, and that leads to saturation of hemoglobin more. Sign of hypoxia is cyanosis. Okay. There is bluish discoloration of the skin and mucous membrane. Okay. Tachycardia, because to increase blood flow to the tissue, heart rate will increase, and tachypnea means increased breathing to increase oxygen saturation to the blood. Coming to treatment, so hypoxia can be treated according to cause of hypoxia. So oxygen therapy can be given to treat the hypoxia. So inhalation of 100% oxygen at normal barometric pressure is very important treatment in hypoxic hypoxia. Since in hypoxic hypoxia there is lack of oxygen. So hyperbaric oxygen therapy mainly it increases the oxygen dissolution in the blood. So one way of transportation of oxygen to the tissue is by combination of hemoglobin, but here the oxygen is diffused in the blood, diffused in the plasma, and get transported to the blood. So this is the summary. So there are four types of hypoxia: hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. So at the end of the class, students should know the definition of hypoxia, types of hypoxia, cause of hypoxia, clinical features of hypoxia, and treatment of different types of hypoxia. This is my reference. Thank you.